What is the maternal mortality ratio, MMR? Imagine a number that tells us how safe pregnancy and childbirth are for women in the United States. That number is called the maternal mortality ratio. It shows how many women die from causes related to pregnancy or giving birth for every 100,000 live births in a year. This helps us understand the risks women face during pregnancy and delivery. It is also a way to compare health outcomes across different places and over time. In the United States, a woman is counted as a maternal death if she dies while pregnant or within 42 days after her pregnancy ends. The cause of death must be linked to the pregnancy or made worse by it. Deaths from accidents or other health issues not related to pregnancy are not included. The maternal mortality ratio is different from the maternal mortality rate, which looks at the number of deaths per 100,000 women of reproductive age. The ratio focuses specifically on the risk during childbirth. Tracking the maternal mortality ratio helps public health officials see where improvements are needed. In recent years, the United States has seen some changes. In 2022, the maternal mortality ratio was 22.3 deaths for every 100,000 live births. This was lower than the 32.9 in 2021, but it is still higher than in many other high-income countries. Changes in how deaths are recorded, like adding a checkbox on death certificates to better identify maternal deaths, have helped improve accuracy. The maternal mortality ratio is not the same for all women. For example, Black women face a much higher risk of dying from pregnancy-related causes than white or Hispanic women. Age also plays a role. Women over the age of 40 are at a higher risk than younger women. These differences highlight ongoing challenges in healthcare access and quality for different groups. Knowing the maternal mortality ratio helps us see where problems exist and where efforts should be focused. It is a key measure of how well the healthcare system protects women during pregnancy and childbirth. While maternal deaths are rare compared to other causes of death for women of reproductive age, each one is a serious event that impacts families and communities deeply. Understanding what the maternal mortality ratio means is important for anyone interested in population health and death rates. It shows not just how many women die, but also points to areas where health care, policies, and support systems can be improved. By paying attention to this number, we can work toward making pregnancy safer for all women in the United States.